All right, thank you. Welcome back to the Dr. Mike and Shannon Show. I'm medical technology specialist Shannon Fanenstein, representing Mazan Medical, and I'm here with Dr. Mike.
Hello, hello. How are you?
So, Dr. Mike, tell us a little bit about yourself.
Okay, well, I am the Chief Medical Officer over here at Mazan Medical. We specialize in urology-based products. Specifically, right now, we're looking at a very interesting product called the Uraval. It's a Bulbocavernous Reflex test, which is a lot of words for really a nerve test for your downstairs area.
Well, and today I have a very interesting question that was brought up. What is the relationship between your brain, the nerves in your spine, and erectile dysfunction? It is Men's Health Month, so I've had that question. So, can you explain what the relationship is? How the
Well,
brain controls the down there?
yeah, and that down there for us men is just so important, Shannon. You got to understand that this is a topic that most men we're pretty serious about. We're not serious about a lot of things, but this is something that's pretty important to us.
It's important to women too.
I think
We would like it to work properly as well.
we're gonna have another video. That's why I want everybody to make sure they're staying tuned. But we're gonna have another video about female sexual dysfunction. But for this purpose, we're gonna talk about ED, erectile dysfunction, or basically the things down there are not working the way they're supposed to. The banana seems to be peeled, if you know what I mean. So we're gonna work on repealing the banana. Does that sound right? Something along those lines. So, it's interesting. So when we talk about neurogenetic ED, we're talking about nerve problems in the area of the body that control a man's ability to have an erection and to hold that erection and to keep that erection going for as long as we need it to go, and even to the point of being able to get to a point of finalizing, that whole process in our body, right?
Again, something very important for women as well.
Oh yes, yes, it's very important. And I've had lots of conversations with patients in the clinical setting about this. And when you talk about that it's important for women, it's kind of funny because it's important for women, wives, if you will, about their man being able to get that, because sometimes they feel like maybe it's them that's causing this to not function the way that it should. Sometimes they even go as far as thinking that perhaps he has somebody else that he's dedicating that time to, and it's not her. So when we have some of these men in our clinic, sometimes their wives are there. Sometimes their wives are just outside the door waiting to get an answer on what's going on, because they feel like down deep that maybe it's them, that they're the
And it's
problem.
wives, girlfriends, significant others, just to clarify.
Absolutely. Well, yeah. Why anybody that might be tied to that's got an emotional tie, that's not the person with the problem down there, that would be the people that would have that second thought about, oh, what's going on. Now, again, that only adds to the stress that the guy's feeling when it's not working down there. And when we talk about neurogenetic ED, one of the biggest challenges with that is when we assign you the little blue pill, the magic blue pill, the thing that's supposed to solve all the problems in us men.
That
And
last 8 hours, or you have to go to the ER.
yeah, 4 hours. Don't, yeah.
Oh,
If you have a problem down there with it, go get the shot, go get it fixed. But the reality is that in some men that have neurogenetic ED, that pill won't work. Neither will any of the pills, because vasodilators are essentially medications that are designed to make our heart beat a little bit faster, the blood to flow a little bit more. Is all great as long as you've got neurological sensation in the part of the body. But if the nerves are dead down there, the blood can flow all at once, and it doesn't really make a difference, and it doesn't really work. So,
and how do they find out if the nerves are damaged or dead?
well, one of the biggest reasons that we're emphasizing this Bulbocavernous reflex test, this Uraval that we have with Mazan, is because that does allow us to be able to test for the nerves of that particular part of the body. We deal with the three areas, right? Pee, poop, and sex. Well, when we're talking sex, we're talking about the neurogenetic functionality of that part of our body. right? I'm being very PG for the purposes of YouTube and anybody else. So if this seems very, very, we'll call it dumbed down, this is for the purposes of all people. If you're a medical professional out there and want to talk to me directly, I'll throw a bunch of big words at you and we'll have a lot of fun. But for these purposes, I want the general public to understand the rationale on what a neurogenetic ED situation is and how some of the ways that we try to work on fixing that. So, it's so important because you want to have these really good conversations, sometimes not only with your urologist, but sometimes with your neurologist, right? And those combinations to be together. And it's very, very important. So I want people to understand that sometimes you can be having a problem down there or really any parts of your body. But if you're not talking to the right doctor, they may not have the right fix for you. It may not be your loved one or your girlfriend or your wife or your significant other. It could be your lower back, that back injury you had long ago when you picked up that box wrong, or that sports injury that you didn't realize was going to cause these kind of problems later on in life. So it's just important to understand that there is another aspect to erectile dysfunction, and that can be neurological based.
Now, is this something that has been tested and proven to see that this actually, the Uraval will work for erectile dysfunction?
Well,
or can screen for it?
Yeah, I'll say that it can screen for the neurological problem that could be causing the symptom of erectile dysfunction. And so one of the papers that I have here, and we'll leave a link to this paper so that you guys can do some white paper understanding. It was done by a wonderful doctor, Dr. Gordon, and he is a neurourologist, and he did an awesome job of looking at erectile dysfunction with patients that have undergone prostatectomies. That's when they've kind of cut out parts of the prostate, and generally that causes urinary problems, sometimes fecal problems, and definitely ED problems in men. So anybody that's had one of those has a tendency to have these symptoms. The key is those are the same people that have had those particular surgeries that also have neurological issues, and we know for a fact that they have because those nerves have been sparred, they've been cut, they've been nipped, right? So in his paper, he was able to determine that, and he used the Uraval, he used the exact system that we're talking about. He was able to individually identify 24 individual nerve roots within the system. 24 individual nerve roots. The reason that's important is, number one, it can tell us if it is a neurological problem, therefore the little blue pill won't work. Wife, husband, significant other. It's not you, it's not some other person.
That would be a big help.
Yeah, psychologically, it's very, very valuable. It puts a huge load off of people when they know that, oh, it's that back that he's always complaining about. It's not somebody else. Right?
He's not making it up.
He's not making it up. He's not making it up. So this paper was really good. They were able to determine that it's very clear that if there is neurogenetic issues going on, it directly reflects with neurogenetic ED or erectile dysfunction. And so how do you diagnose that? We're able to find it with this BRS system, this Uraval system that we keep talking about and harping about, because it is a fantastic find to be able to give that piece of knowledge. I look at it the same as I had my arm hurt. I'd probably want to get an x-ray to see if it's broken or not, because if it is broken and I don't fix it or not properly fix it, I'll always have problems with that for the rest of my life. This is kind of the same concept. If I know that it's neurogenetic, I can treat it based on the fact that it is neurogenetic, and not go through some of these different things that people do, not only just like the little blue pills, but also some of these devices that are just basically increasing blood flow, which doesn't really seem to do very much for people that have neurogenetic ED, if that makes sense.
So for our viewers who are watching this, if you had 3 key takeaways that you would be able to, provide them with, what would your 3 key takeaways be for today?
I would say that if you're dealing with, looking at the little blue pill and for whatever reason it doesn't seem to work, don't beat yourself up. You're probably looking at a problem that maybe a neurologist or a neurologist should look at, perhaps maybe more than a urologist should look at. So I want you to make sure that you're really using your specialist out there to make sure that you have a clear understanding of what's going on. I want people to know that, it may not be you, significant other. It might be literally that back injury that they're talking about. I want people to feel like it's not necessarily a problem that is a relationship problem, and they should be together in the good health of their partner, right? And then finally, I want the practitioners out there in the world to know that there is something out there that can test for this and give us really, really good understandings of what's happening neurologically speaking that could be causing those symptoms of pee, poop, and sex.
And it's a quick, easy, non-invasive, no electrical stimulation, 5-minute screening test that they'll have the results right then and there.
Yep,
So
and insurance
Dr.
pays
Mike,
for it. So it's really
yep.
good.
And we really appreciate your time today and being able to help, especially our men out there, especially with it being Men's Health Month. And thank you again for your time today. And all of you, we look forward to having you see our next video that is coming out. And please don't forget to like and subscribe to our video. It really helps us put out additional content and being able to research and talk about topics. So thank you very much and have a great day.
Thank you.